Hi everyone. I haven't shot a video for actually a few months and I'm sorry about that. I've been innovating a lot of things that you will start to see coming up hopefully in the next 1 or 2 years that I really can't talk about just yet. But I will say that this video idea came to me from a patient yesterday that I did a blepharoplasty on about a week prior. I was taking out her sutures. I had told her that she really should consider a fat grafting and that she probably would see the effects of what fat grafting would look like in her upper eyelid after her blepharoplasty, and probably then think fat grafting would be a great option for her because she couldn't quite conceptualize why fat grafting in the upper eyelids would not make her eyelids saggier. And I always use the analogy of like a balloon that gets inflated, that when it deflates, it looks like you have to cut it all away. And that is why I think people are overdoing eyelids, taking way too much out, taking fat, muscle out, lifting brows up that don't look like when they were younger. So she, at a week, because I don't have that much swelling, there's just enough swelling that when she looked at her eyelids, she says, oh my gosh, I can totally see why fat grafting would work. So now she's thinking about a fat grafting. And so the honeymoon swelling means that period of time, not when there's distorting swelling, but when there's swelling that just looks pretty good, and then that swelling goes away and you realize, oh, that's not really what I paid for. I used to see that a lot when I was doing brow lifts more about 20 years ago, and the patients would like it more swollen, and then I heard a lecture on fat grafting in 2004, and that completely changed the way I understood brow aging, that most of it is actually involutional, in other words, loss of volume, and not brow sagging. So that is something that's, to me, a very good revolutionary way of understanding eyelid aging is volume. And so when there is some swelling there, not the kind of distorting swelling again, but a little bit of swelling, that may show you what it could really look like. Now, what's interesting with fat grafting is you also go through a honeymoon swelling of sorts, but it's delayed. So essentially with fat grafting, you're adding volume, but then you're having more swelling. And essentially that initial swelling that is there is actually not looking good. For the first 1 or 2 weeks is actually deforming, and you probably think I put too much fat in. That honeymoon swelling that occurs with fat grafting really occurs at about 4 to 8 weeks afterwards with some variability. So you go through a period of time initially where you think I put too much in, then you go through a period of time you think everything looks perfect. And then when the swelling dissipates, you think, oh, it didn't last, it didn't work, when actually it really did. You just forgot where you used to look, what you used to look like. So I have found that this honeymoon swelling is delayed with fat grafting, and it's not representational because fat also is a graft. So when the graft settles, and maybe not every single part of the graft survives, but the vast majority of it does, and it's pretty uniform. So it's just the fact that honeymoon swelling is a time where everything looks as flawless as possible, and then it goes down. Now, people say that, someone mentioned this to me the other day, it's, oh, that can occur with facelifts. Well, sort of it can, because the facelift is ultimately very tight initially, but that swelling in the facelift, to me, is not necessarily honeymoon swelling in a lot of my patients, because a lot of my patients that are undergoing facelifts are also undergoing fat grafting, so they naturally already have the swelling that's there, but more by virtue of the fat grafting. So I usually try to tell patients that honeymoon swelling is creating volume. It's creating a volumetric change to the face in a favorable way when you're doing non-volumetric work. But, as I said, with volumetric work, down the line, there can be some component of honeymoon swelling where it goes through a perfect phase and then it settles down a little bit. So these are the concepts of honeymoon swelling, is that it helps people understand the importance of volume. Now, not volume like you see people walking around with these overblown cheeks that look ridiculous and overinflated faces. You know, good volume is indistinguishable. You cannot tell it was done. It does not look operated on. It looks seamless and looks really good, both smiling and not smiling in every angle there.